heavy people sending things in. So, hello, Shannon and Dr. Doreen. As always, I love the show. You guys are awesome. You are too. I have a 4.5-year-old with ASD and language delay. He goes to school full day and has 30 minutes of speech individual and 30-minute group. Same way with OT.
So let me just write some of this down.
Sure.
Could you,
so full day of school, he's 4.5, ASD with a language delay. He goes to school full day, has 30 minutes of speech individual and 30 minutes group. Same way with OT. I'm concerned that there are times I can almost understand what he tries to say, while other days I can't, even if it's words I hear him saying before, almost like he forgot how or can't say the word. In those days, he sounds like he has something in his mouth, like his tongue gets in the way of the sounds, like he mumbles. Also, I noticed he also tends to drool a lot on those days. Maybe it's nothing and unrelated. I mentioned once apraxia. Are these the signs? Should I worry at this age that he might lose language words he's already learned? My oldest, when he was 3.5 to 4 years, was able to pronounce words he learned and couldn't understand some words and was not diagnosed until age 6. I was told once in ASD language usually regresses from 2 to 3 years and some kids not after that. Please help.
Well, sure.
So 2 kids on the spectrum, one that's 4.5 and one that we don't know how old the age of the other child was, but wasn't diagnosed till 6.
Right. So let me just go back. Did you get any understanding, Shannon, of whether there's ABA in place?
I am not seeing whether or not they have ABA.
Okay.
That wasn't mentioned.
Okay.
So if you're watching, let us know if you've already got that in place. Because if you don't...
If you don't, you should.
Yeah.
And of course, the number one thing here is, and also if you're going to write in, please tell us what type of school placements we're talking about here. So it's school full-time, and you are only literally getting 30 minutes of speech individual and 30 minutes of group speech. That's not even touching the surface at this point if your child has ASD diagnosis, and if your child is even the highest functioning possible 1 hour of intervention, and let's put the OT aside for a minute because that's not going to affect language, but so 1 hour of intervention is not even near enough. So, and it doesn't really matter if the school is ABA based or those types of things that we hear. ABA is one-to-one. And so you need to have a professionally trained ABA provider providing ABA to your child, and your child's 4.5, so he's right in the middle of the golden years, I would say, and so you should be receiving somewhere between 25 to 40 hours per week of one-to-one behavioral intervention in order to make your child's language improve and hopefully get to normal. The fact that your child is drooling on certain days and also has a lisp, that is not apraxia. Apraxia is essentially the lower muscle tone in your tongue. And so the child is not able to move his tongue around fast enough to produce all the sounds that we produce together with air and so on. So, and speech pathology is actually the right way to go for helping overcome apraxia. So, but not 1 hour a week, not 2 hours a week, this is just nothing. So, I would really go to your school district and request much more speech. I don't know too many kids, but if you insist, they will give you speech daily, and I think he should be receiving speech daily, and then you should have a conversation with your speech therapist about working on the sounds and the production of sounds. This is really important because if your child gets to the point, once they get to the point where they're speaking more in words and sentences, if the enunciation is not correct at the very beginning, you'll have a lot of stuff to clean up. So it's better to do it right now. The drooling is more likely related to some biochemical, I don't want to say deficiency, could be an excess, I'm not sure. So that would have to do with what is he eating, what supplements is he taking, has he been allergy tested. You should really be consulting with a physician probably first. Get some blood tests done, look at allergies, and then I would look at, there's a lot of actual hormone issues that the physician will probably want to test in order to see what's going on with drooling. And then you will probably end up talking with a nutritionist to set an appropriate diet. that will make a big difference for drooling. The fact that he loses language also has nothing to... you asked whether he would lose language. I don't think that any of what you've listed here suggests that he will lose language at a certain point. So typically, very, very, very few children lose language past the age of 4.5. Trying to think, maybe I had 1 or 2 cases which were really tied into other pretty severe illnesses like severe epilepsy and so on.
Okay.
Hopefully that answered all these questions.
Yeah, there were a lot of questions there. Now here's my follow-up. So, because I've recently tumbled to the fact that my son, I want his diction to be better. Mm-hmm. He can be understood most of the time now, but I want his diction to be better. Mm-hmm. And I was reminded that the reward for it isn't big enough for him recently. I was reminded of that. So the fact that this child on some days has enough diction that he can be heard and understood and other days doesn't, would that tie into that at all? Do we need to up the reward for when he does articulate?
Right. So, my philosophy on life is that when you, if there are numerous things that you want to improve on, mm-hmm. you try to get them all within, inside the limit of normal, and then you gradually improve each one. So let me give a better example of that. Let's say I want to improve how I sleep, mm-hmm. and my hygiene, and how I exercise, mm-hmm. those types of things in my life. Okay, so what I eat, how I sleep, and how I exercise. Okay. I don't know, those types of things, or 4 things. And they're all subpar. And because there's a lot of things there to focus on, I would want to bring them all within a range that's acceptable and then focus on each one. So really, and this applies to you as well, if the child is understood by others, maybe 90% of the time, are there more pressing other things that you could be working on? There's, you have to pick your battles here. Do you want to focus on language and enunciation and make it, Shakespearean perfect, while the child doesn't have social skills,
exactly,
or safety skills, right, or other things? So you need to kind of, lower your expectations, get everything within a level of acceptability, and then pick what's more appropriate or more important to you and to him.
Right.
To him. Sometimes, and that's really important. Sometimes something is important to us but we're embarrassed by it, let's say, right, and it's not that important in his life. Right. So that's how you I suggest how people choose. Okay. So I don't know very much about this child. The bigger issue to me is just there's not enough intervention occurring. Okay. Great. And then let us know if you are getting the ABA, because there are a lot of things within the ABA that they could be targeting to help. Yeah, and I don't know, have a feeling, but maybe I'm wrong, but sometimes parents feel that once they have the child in a school program, it's really... and the school says, oh, we do ABA. All of our people do ABA typed intervention. That's not ABA. Yeah. If you see a real ABA program, it's not something that's administered by one teacher to 20 kids. Right. Right. Very important distinction. Okay, moving on to the next question. For Dr. Doreen, when working on IEP goals, how do you figure what is a good level of progress for a year? I always feel like the goals suggested for my son are way too short-sighted to represent a year's work, and I'm almost always right. However, I have a hard time justifying it to them when I change their goals to be more challenging. Thankfully, they don't usually challenge me on it, but I guess I'm just looking for ideas of how to know what's a year's worth of work. Some of the school goals supposed to represent a year match the CARD goals that are not expected to be year-long things. So CARD might say this is something we're working on for the next 3 months, but the school is saying a year. It sounds like this is a parent of ours. It does sound like that. Yeah. So first of all, I agree with you completely. I find that let me just give you a couple of anecdotes about this. School goals, IEP goals, are generally, to me, a joke, and attending IEP, to me, is a nightmare. And I've done many IEPs for many parents over the years. And the reason I say that is because truly I sit there and I think that the IEP is a very clear example of how very, very little our school system expects of our children, and how it has just become a bureaucratic process where no one really is supposed to be, listen to the name of what this is, an individualized education plan. Oh my goodness, that's the most important thing that could possibly be for our children, right? And yet, for many, many, many years, we've had numerous school districts who limit us to 3 goals per year. 3 goals per year. That to me is just, it should be illegal. So, work on your IEP, yes, make your goals go faster with the school district. Push, and yes, I feel our goals are about what we accomplish in about 3 or 4 months is what the school attempts to accomplish in a year, maybe even 2. And of course the process is to push the child as much as possible so that they catch up, and it's not the idea is not for the child to go at the typical pace of his own age or even slower than a child of his own age. The idea is for the child to go 3, 4, 5 times faster, because the concept is we want him to catch up to other children his age. But having said that, this is again one of those situations where I have to say, choose your battles, because realistically, if you have a CART program and if you're able to get full coverage through your insurance, then the purpose of school changes. Then school is no longer there in order to teach skills. We're teaching skills. The purpose of school becomes more generalization of skills and socialization. So make sure, so in some ways the battle of what are they actually teaching my kid becomes less meaningful, because there's a whole other group of people, teaching your kid. Yeah. So the main thing is to worry about things like, is my child generalizing all these things that he's learning at CART? So let's say we're teaching him, language, conversational speech. Is he beginning to use that? And that's, hopefully if you have funding, or if we're able to get, over the years, as you know, Shannon, it's harder and harder to get school funding. Of course, some districts, and I really respect LAUSD because they've continued with us. We have probably the highest number of kids with LAUSD, but they really do allow us still to go into the schools, shadow our kids, and get out. And that's been fantastic, and I thank them for that. Some districts won't even let our shadows in, but regardless, our shadows are therapists, and the therapist is trained in a way to actually shadow the child and to kind of help the child pay attention to important things, play with other kids, generalize all that. The importance of having one person who goes to school who's part of the child's team is they know what the child's mastered. So like this week the child has mastered, let's say, the use of past tense, then this shadow will pick up on whether the child is using it incorrectly at school, whether they're actually using it with peers. These are very, very important things. So the focus of school then becomes it becomes an environment where you can practice the things the child has learned with other kids. And also, obviously over time we want to be able to fade out, and school is the normal environment for the child, so we want to make sure our kids are successful in that environment. But so, as if you have an adequate program, then you shouldn't worry too much about what's actually in the IEP, because we're going to go way past the IEP anyway.
Yeah. I want to say just on the other side, because I've sat on the other side of the table, IEP, as a teacher as well, that just so everybody understands, one of the reasons why the school takes such a passive role in putting those goals down is because they're legally responsible for them.
Yes.
And they're terrified that the end of the year comes and if the child doesn't meet the goal, then they're accountable. And it can create a problem not only in that child for them, but across the board, that if their programs are found to be ineffective, it holds them accountable. It's the actual thing that it needs to be, but it frightens them.
Right.
So and if you know you're battling that, then you can approach it in a way, and I think exactly, picking your battles and saying, this is the one I want to hold you accountable for. You're not saying that to them, but no, that's how you have to approach it.
This is such an important point you're bringing up, Shannon. It truly is. So the school will be very, very cautious because they don't want to be accountable, but if you look at the IEP, and by the way, if you're a CARD parent, your CARD supervisor should be at the IEP with you. Although nowadays we're very restricted, like, our insurance families, we don't get funding for attending things like the IEP or even school services. Our insurance carriers don't allow us to go to school. Yeah. So hopefully we can get some school funding to cover that, or you should actually privately pay for your supervisor to go with you. It's very beneficial.
Yeah.
One of the things about this is that on the IEP document, it actually says who is responsible for these goals. And if you have a CARD representative there, you can get those IEP goals, CARD's IEP goals, into the official IEP. As long as CARD is held responsible, they'll be okay with it.
Yeah.
And then what happens is at least someone in school is notified of how far your child is expected to go. And then in the IEP, it can specifically say, once this is mastered, the objective is mastered, the school can be held accountable for generalization of this task or this skill.
Oh, that's a great thing to write into an IEP. Wonderful. But I think we should take the question that came in on Facebook this morning. Hi, this question is for Dr. Doreen. My 4.5-year-old son loves letters. He's always writing in the air with his fingers. When I see him, I remind him that if he wants to write, he can ask for a notebook and pencil. Then he'll ask for it. I heard before that kids who love letters or writing so much tend to be good later on in life, even if they stay on the spectrum. He can write at least 10 words when I ask him to write them, but he chooses to write random letters and then he'll make up a word for what he wrote, which only he understands. He knows his ABCs, all lower and capital letters, can read a few words, and can talk in 4 to 5 word sentences, but still not conversational and has poor social skills. My question is, can someone with poor social skills and yet not conversation at his age do good later in life? He's really smart, but sometimes he can look like he's in a shell and ignores most people. Ignores most people that he does not know, and they said thank you so much. And this is a dad who wrote in. Love it.
Yes, so I love the question as well. I love my hyperlexic kids. I love them. So kids who get into letters and reading and so on very early on their own do tend to do better. So let me just say that it is it's an indication of numerous skills. One is that they have an incredible memory. Being hyperlexic, just having an affinity with letters is such a useful tool. You basically can, at any time, use that to increase the child's language, increase everything, social skills, and so on and so forth. And anyway, having that type of memory allows the child to essentially overcome a lot of different things. So generally, my kids who are hyperlexic have very good prognosis. Having said that, I really encourage you to get into a good ABA program, hopefully CARDS, but if you find a really good provider, your child will do very, very well. I really suggest that you heavily hit the ABA. Air writing, writing letters in the air you should start, if you have an ABA provider, this is how we intervene with that. We've been pretty successful with some of our kids. We'll allow it initially, but we'll limit it to specific time frames, sort of like you can do it if you're in your room alone. You can do it if you're in a private space, but you can't do it outside of that. And then we will gradually, as the child progresses and gets better with things, because these children tend to progress pretty fast. Also keep in mind that if this is a hyperlexic child, you need to present materials that are visual all the time. So auditory instruction might be hard, like, multi-step, go to your room and get this and blah, 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 and all that might be very hard for the child initially. So you can write it down, and the child will really remember steps to very complex things by reading it a few times, and then you can remove the visual. But instruction should be administered visually with kids like this. But what I found is that when you do that, really work on both, then gradually with time you can allow the child to transform his sort of interest and energy in letters into something very good, something very socially acceptable, like, for instance, Sudoku, right? So one of the things that we teach our kids when they get to a certain point is to do like crosswords and Sudoku and that sort of thing, so depending on whether he's into letters or numbers. So, and most of the time kids are into both. letters and numbers, it varies. But anyway, you can really turn this into something good. I do really highly recommend that you get involved with an intensive ABA program.
Would it be overstating it to say, you know, I always think of sometimes when our kids have a clear strength in something, that if we don't jump on that and harness it, that sometimes it's almost as though it comes back to bite us in the end if we don't get on it and harness it. And I feel like this parent's having a lot of anxiety that, oh, there's this thing, I kind of think it's a plus, but what if it's a negative? And I fear for him if he doesn't jump on it and get some help, that it has the potential to be a negative.
Well, I mean, yes and no, I guess, and it's a really great question, Shannon, because it allows us to look at this from a few different perspectives. So sometimes as parents, we want something for our kids that they're just never naturally going to develop. For instance, I might want, you know, my son to be highly athletic. That's just not reality. He's never going to be athletic. So it's not his interest. He did not develop with someone who forced him into athletics at any point. His natural interest took him into comedy and writing and so on. And so that is where he's very motivated. That's where he's successful. That's what he's interested in. And so that's great. Now, if I was someone who considered every boy who is non-athletic to be a failure, then we'd be at odds for the rest of our lives, right? He would feel like a failure, and I would feel sort of embarrassed because my son doesn't do the things, whatever.
Yeah.
So the real question is, some of these things, you know, like for this child, for instance, you should probably gear him towards something that is going to involve letters, because this is something where the child has interest. That means he might, going forward, not really be into sports. He might very well be into computer games and so on and so forth. So he's going to develop into more of that type of kid versus the athlete who's out there. Now, having said that, we have kids who are extremely hyper, run around all the time, they really are competitive, so on and so forth. Those are the kids that I will push into athletics because I kind of want to calm them down a little bit.
Right.
So you really have to look at the child's personality first and kind of where their natural interests go. Everybody has a certain level of different brain development.
Yeah.
You know, we go to different places. But with that in mind, you want to still steer them, obviously, because you don't want someone to do only writing letters and nothing else, right? So you kind of have to keep a balance. Every life is more healthy when it's balanced. But allow and help grow those things where the child is naturally drawn to those things. I even have adults, you know, who were never really taught well when they were younger. And when you look at them now, some of them I just love. Like, I think of them and I'm happy. But what you do with them is you allow them to show you what they're interested in. And this could be completely something you've never even thought of. Some of my kids have huge interest in art, huge interest in music, like crazy ability in music. And then like some of my adults or other kids are like just interested in things like food preparation. Cooking, you know, those types of things. And then you have to encourage that as much as possible. But you are right in that we really want to pay attention and make sure that there's somewhat of a broad array of things there, because we don't want our children to be completely excluded from anything as well.
But build on the strengths, encourage them.
Build on the strengths. That's the most important to me, because for the kids, I don't care what level of functioning they are, they need something they're good at.
Yeah.
We all do, and that is probably one of the most important things.
Yeah, absolutely.
Sure,
I mentioned that we'd had several questions come in that involve nonverbal individuals. So let's start with my son is 6, turning 7 in March. He's nonverbal. And this, you know, tears my heart out and steps on it. And the question they ask is, will he ever speak?
I can't answer that. I don't know, because... Have I had children who developed speech after 7? Yes, I have.
Okay.
It really just has to do with... Okay, so I have several things to say to you. One is, have you done interventions? If you haven't done intensive ABA, then you definitely should, because there's no question that you haven't, we don't know the answers unless we've tried. So you really should try to do some intensive ABA work. If not, it doesn't have to be just on speech, obviously, but it could be heavily focused on development of speech. Secondly, you should do ABA anyway, because who cares if he doesn't speak, as long as he communicates. I think that's the second best thing that we can hope for. And communication can occur through sign or through a picture exchange communication system of some type, or just any kind of augmentative device, iconic communication, so writing, reading, and so on. We do need to teach those things. So he's not going to pick those up naturally. It all needs to be taught. And I think the most important thing is not whether or not he speaks, it's whether or not he can communicate. And nowadays, obviously, communication occurs in a multitude of ways. If you just think about the standard communication that occurs between children and adults and so on, it's this. It's texting. So, we can teach your child, and with things like Siri, or now there's AUG devices of all types, as long as he can write, a computer voice can speak for him. The more important thing is just the ability to communicate, because he needs to be able to say the things he wants, to say the things he wants to avoid, the things he really wants in life, his immediate needs, his long-term needs, his pains, his problems, his complaints. All of that has to be voiced, his desires, his wishes, all of those. So communication is important. And yes, it's possible that he'll develop speech. I think at 7, what I would do is I would try to go with a non-verbal communication system first. So I would implement a PEX system, picture exchange communication system first, so that my child can communicate and the frustration goes down. And then I would gradually start to pair language with it, speech sounds with each request, so that we can see if he can develop. Speech therapy can help as well. I don't know his level of apraxia. I don't know all of the abilities, but absolutely. I mean, I've had children who've developed speech after 6, 7.
One of the things we've talked about before on the show is that parents have a huge fear that if they go to a PEX system or an augmentative device, that means that they've given up. And that their child, it will preclude any ability for their child. The child will never learn to speak just because they made that decision.
Right.
And we've talked before about the fact that studies have shown that it's exact opposite.
Yes.
That kids are, if they're going to gain speech, they're more likely to gain it quicker and more likely to gain it, period, if they've had functional communication on board first.
Right.
So what, you are so good at perspective taking and helping us to get through our fears. What do you say to parents who are having that moment of feeling that loss of, if I go to this, it means that I gave up on my child?
Right. It's very similar to the kids who are very strong with visual memory, right? So we use visual things, like we write instructions to them and teach them to write back and so on. And, in that case, I could see a parent thinking, oh, he's never going to understand a vocal instruction, or he's never going to vocalize back. But that's not the case. These are the things that our kids tend to be stronger with, and we pair them. So here's what an iconic system, like a visual system, does that an auditory system doesn't do. So I will say 3 labels, dog, cat, and mouse. Okay, so the moment I say them, that stimulus, the word dog, cat, mouse, has disappeared. It's gone. It no longer exists in time. So either you were turned on and paying attention at that very moment, and your memory was intact and you were able to retain that when I said it, or it wasn't, in which case by now you're already confused whether it was dog, cat, mouse or dog, mouse, cat.
Right.
Okay. Now, if I write something down, it's visually present. It doesn't disappear. I can say it, and now I can maneuver the time. Now I can manipulate. Do I hold it in front of you for 5 seconds? Do I hold it in front of you momentarily, longer, whatever? Does it allow you to then focus better and retain better? Obviously it does. That's why we write things when we want to memorize them. So the fact that we use iconic systems or visual systems does not mean that the other won't develop. In fact, it strengthens the other, because what we will do is I'll say dog, cat, mouse, and I will ask you to try to imitate it as well while I'm saying, if let's say you want juice, and I'll write down juice or want juice, and you'll say, and I'll try to prompt you. Well, having a visual will be much stronger prompt, but I will still, even if you just touch the visual and tell me I want juice, I can always still ask you to also enunciate it. Also say want juice or whatever aspect of it you can. So the visual systems always help. I've for years and years, before PECS was made by Andy Bondi, which was in the 90s sometime, I used to use visual systems as a prompt technique. I always used to use them to prompt my children to actually vocalize.
Okay,
So it will never prevent vocalization. Don't fear that. Neither will sign.
Okay, great. Okay, and then continuing on, hello, I'd like for my 4-year-old nonverbal daughter to wave hello and goodbye to family and friends. How do I teach her that? And thanks for your help.
Oh, that's a pretty straightforward and easy task to do. I would do it through modeling. First thing you would want to see with the child is whether a lot of children, if you teach them to wave like this, they will actually do what they're seeing. So if I do this to you, what you see is this. So the child will try to imitate exactly your hand. So this is your hand. I'm the child.
Right.
And so the child might start to do this instead of doing this.
Okay.
Right? So test that and see how the child imitates. I would just teach imitation. And then a first thing is, so do this, okay, or however you have to do it for the child to do it. Do this, and then if the child can't do that, then of course you drop to shaping that by doing physical modeling. So you take the child's hand and show him how to wave, her. And then gradually the do this turns into wave. And then gradually you drop that and you pair it with, let's say, hello, so that the child knows that whenever they say hello, they will wave. But I mean, I wouldn't just focus on something that basic alone. Often we try to, I don't know why you want to teach your child to wave, so that's how you teach it.
Okay.
If you want to do that, that's the way to do it. And also, waving is an easy one because you can start with imitation. Any task that you can start with imitation, start with imitation. Teach the child just to do this. It could be do this. It could be do this. It could be whatever it is, do this. Once you get the command, do this, you can teach a million things. And then gradually what you do is just change the command to pick up pen, drink from cup, whatever it is.
Right, sit down, all those different things.
Right.
And by the way, I just have to say that all these lessons are available in Skills.
Skills, you should really look at Skills. You should also look at IBT. For something as basic as this, I feel like you should learn the techniques of ABA, sort of the procedures, like, how to shape a new behavior, how to introduce a new behavior, all of those types of things, because once you learn that, then you can generally apply it to very basic skills. I think our skills program, the website, becomes more important when you're trying to build a lot of skills, teach the child everything they need to know.
Yeah.
If you want to do just basic things with your child, then just learn the techniques. You'll apply it to almost everything in life.
And I don't want to put words in your mouth, but one of the reasons why this is so sweet, and there's an element to this that's so sweet, is that there are so many things that you can teach your child. There's so many things that you could want to teach your child, and this is one of the most basic things. And I think once you learn the technique to do this, it's like the keys to the kingdom.
Yeah.
And then
you'll
I
be
hope,
reinforced. You'll be so happy.
Right. I hope that it will enlighten you, that you go, oh, okay, what else can I teach her?
Right.
And then I think your whole world is going to expand so much.
Very true. Very true.
That it's an exciting time for you, that this is what would make you happy, and yet you're going to walk through a door where you're going to see like a shopping mall full of stuff that you could pick to teach her.
Absolutely.
Which will be very exciting. We get a lot of questions about scripting. So I have another one here. Hi guys, my 4-year-old son scripts so much the whole day. He has language and can communicate with us. He scripts about shows and things that are being said to him at school. When he's scripting, he acts like he's in a whole different world and ignores almost everyone. I'll ask him, what are you talking about? He'll answer, I'm talking about the show. In his autism school, they're going to implement a plan and reinforce him with an edible for not scripting. But what can I do at home to replace the scripting, which I know is really reinforcing for him? I know this behavior is really hard to break. I've read before, and I'm scared that since I'm not a professional, if I'm implementing something at home, it won't work, but I need to do something because hearing him script so much is driving me nuts. God bless you guys and love this show so much. And that's a really important thing, that there are things that our kids will do that will cause us to, go a little batty, where you're just like, I can't take it 5 more seconds.
Right.
We get it.
Okay.
Everybody's been there before.
I'm kind of going to tell you what to do.
Okay.
Just want to make sure I don't forget anything.
Okay.
Okay, so first thing is that you need to reduce the shows he's watching, okay? Because, in other words, in some ways you're going to now, this behavior exists. We need to reduce it and shape it. And in order to do that, we want to stop feeding it first, right? Because it's being fed by what he watches. So let's reduce that, first thing, okay? Let's reduce, I don't know how many hours he's watching TV or computers. Let's reduce that to, I don't know, a third or maybe half, something like that.
Okay.
Now, if once you do that, that means you've now reduced his reinforcers. So you immediately have to replace the reinforcers and balance out his life again. So keep that in mind, that he now will need additional reinforcers. Well, that's good, because you can now reinforce him again for all appropriate language that's non-scripted. However, I want to say that kids who script are trying to communicate. They don't really know how to communicate otherwise. So the tactic of just reinforcing non-scripting is not going to really work, because the child's they're going to be either silent or script. They're not going to know how to communicate otherwise. They're trying to be social. That's when they script. So what you would do is 2 things. One is, first of all, you control the time. So you will say scripting is allowed, like not scripting, but that sort of, let's say scripting is allowed from this time to this time. So in order for you to do that, you have to get a baseline. Just like you're getting a baseline of, this week he watches every day 3 hours of TV. Now we're going to make it 1 hour, or we're going to turn it into whatever, 2 hours, and then gradually 1 hour. Okay. Gets your baseline, and you're reducing it. Also get a baseline of how many minutes during the day he scripts. So every time he scripts, turn on a timer. Just on a Saturday or something, and don't interact with him. Do not start saying, what is this about, blah, blah, blah. Just see what happens. See what the duration of time is. And once you get that duration, your goal is to gradually reduce that. So the best way to do that is to actually reinforce him for not scripting during specific phases of time. So at dinner time, we will not script. Okay, so if he scripts at dinner time, he'll lose something, like let's say he'll lose dessert or whatever it is. If he's able to keep it quiet for dinner time, then you will heavily reinforce him.
Okay.
And dinner time might be too long. I don't know. You start with something that will generally give him a certain level of success. So something that's not too hard. A very easy one would be, for instance, we will not script during our nighttime routine getting ready. Why do I say that? Because the nighttime routine involves things like brushing teeth, which are incompatible with scripting. Okay. So naturally he won't script.
He's much more likely to be successful.
He's going to be successful, exactly. So what you're trying to do is you're trying to control the scripting to certain time frames of the day, and at the same time you're reducing the overall amount of scripting. Now the most important thing you'll do when scripting occurs, now keep in mind he's I think how old? 4.5?
4-year-old.
Yeah. So this is how typical kids communicate with us at that age. Mom, remember when I was watching Thomas the Tank? He said blah, 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 and then it's a script. Okay, so what our kids don't do is they don't introduce the script. If they introduced the script, it'd be fine.
Yeah.
They'd be doing what every other kid does. So there's a couple of things you need to modify about his scripting. One is you need to teach him to introduce it. And saying from the show after you respond is not the way to do it. That's not okay. That's not enough of a response. The way that you do it is you figure out this. Most kids have typical scripts. And so you'll write on a card an introduction for each of his scripts, like written introduction, if he can go with visuals. If he can't, I'd take a picture or something that is a reminder of the show that it came from, and you'd show that to him. So when he starts scripting, you keep him quiet either by putting your hand on his mouth or going like this, whatever. Teach him to be calm, and then show him like that he's supposed to say, and you can model it verbally as well for him to say, "I watched blah 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 show and then he can script." Okay? Give him an introduction that he can use, and then modify the introduction as well. But initially, you're just going to give him a straight statement that's an introduction, because, so that's one thing you want to teach him, is how to introduce the conversation. And then the second thing is you will need to teach him to, after he's finished his script, to maybe ask a question of you, or maybe listen to something you say. One of the biggest issues with our kids who script is they just want to continuously, they don't care if you're listening or not. And they're not going to listen to what you say after that. They're just trying to communicate. They don't understand that conversation is turn-taking.
Right.
So what I'm suggesting is that in addition to modifying or molding the script by giving it an introduction, you will need to teach the child turn-taking in conversation. And, these are pretty advanced things. I do recommend some guidance. So a good behavior analyst could really help you with this. Not every behavior analyst will know this stuff. Go on Skills. Use our website, Skills for Autism.com. Please go there. Go in the conversation area. It'll teach you how to do conversation. There might be something on IBT about how to avoid scripting or repetitive speech, or how to model it. I'm not sure, but we'll try to put something in there if there isn't.
Absolutely.
But scripting is a high-level behavior. It is harder to deal with for most, unexperienced behavior analysts, but it isn't hard for anyone at CARD could teach you how to work with scripting. And of course, one of the things you can do obviously also is just get supervision from us, so we can kind of guide you through those steps.
I think it's remarkable the difference. I'm all about empowering parents and teaching you to do whatever it is that you need to do. But let's face it, it's so much easier if somebody else comes in, sets it all up, and then you just have to run it. And it's just a world away. And then if you can't do that, having somebody else talk you through it, one of the most pivotal moments for me as a parent, and the person wouldn't have to physically be there, but one of the most pivotal moments for me was when my son was having a meltdown and the therapist was finishing their work to leave, and I said, "Oh great, now you're going to leave," and I'm in the middle of the tantrum, and he said, "I'm not going anywhere, I'm going to be the voice in your head," and he talked me through it the whole time. He just whispered in my ear, and he could have done that on the phone, and said, "Now you're going to go do this," and he said, "Now you're going to go, we're not attending to this, now you're going to go water plants," and my child was hugging my pants, trying to pull my pants down, and he was like, "You're going to keep your pants on, but you're not going to look at him, you're not giving into it." And at one point I started to giggle and cry because it was so emotionally charged for me, what was happening.
It is.
There's no question in my mind, I could not have done it if he hadn't been talking me through it.
Right.
So having somebody to get you through that
is important.
Amazing.
Yes, it's very important. So good
and
luck.
You can do that. You can do that. Those are
I
open
hope that you're in a state where you can actually get good coverage. And, we would love to help, of course, but this is a big issue and you should have it dealt with professionally.
There you go. Okay. Somebody writes in and says, "Hi, thanks a lot for your wonderful show. I have some questions regarding how to make my 11-year-old do his activities independently. He expects a confirmation even for the steps that he knows. For example, for brushing teeth, I have all the steps written on a sheet with some small pictures. Love this parent. But even if he reads them, he will read out a step and look at me and repeat till I say yes. If I try not to be there, he will simply stand, or he might come searching for me to tell him to wash, brush, etc. If I remove the sheet altogether, even though he will come and tell me the step. He knows the steps well, and he knows the actual step to do physically. Sometimes I do give him some extra instructions based on the situation, like wash the brush thoroughly, spit one more time, etc., to make the brushing clean. I can let go of this perfection, but my issue is I don't know how to fade my verbal response, such as okay, or a nod when he tells a step. Any tips would be great. Thanks a lot. Great question. Because our kids can become prompt dependent.
Yeah.
And that's what this sounds like to me. Am I in the neighborhood?
Yes, absolutely. So, but it's also one of those scenarios where we haven't done things in a specific order. So you have a fantastic system already in place. You have a sort of visual sequence sheet on the board. That's great. And he follows that. But the only problem is that every time he does each step, he wants you to give confirmation. Okay, stop verbal confirmation completely. Okay, so go to... Okay, drop the to just, and you will just have to do that maybe a couple of times. You'll have to pair it with and then you just drop the verbal, and you'll be shaking your head. And then you'll pair your shaking of your head, and you'll teach him to actually go to the board wherever the pictures are, or just give him a piece of paper and have him write yes. Okay. Or do a check mark if he can't write yes, or an X, doesn't matter. He basically, in other words, you're now handing over the confirmation to him. Okay, so you're still doing this, and when you do this, he's like going over and writing an X, so that I did this step. Okay, now your this is very easy to fade, right? You could be doing this, and then you could fade to, that'll be the least. And by the time you're fading gradually over a week to this, he'll be doing his check mark and will not barely be looking at you, and just stop doing it. And actually, if you need to, you'll prompt now by putting the paper in front of him, and he'll know he's supposed to check. Okay, so now you fade yourself out and you hand it over to him, regulating himself through a piece of paper where he checks each step. The whole time you're standing there, you cannot be, this is step 2 now, where you will leave the room. So the whole time you're standing there, he gets really fluent with going through each step, checking off each step himself, and you're still standing there. Now is phase 2. Phase 2 is you take a step out. Okay. Tomorrow you take 2 steps out. The next day you take 4 steps out. You now gradually physically remove yourself. Notice we've already done 3 different things. The first thing you did is you faded from a verbal yes to a physical. Then you faded from this to him writing this. Now you're fading yourself out of the room.
Love it.
And now your child should be able to do these things, at which the end of the sequence he can come and get a reinforcer from you.
Okay.
Now, and then finally, that's the phase where you can actually come back and give pointers about perfecting each step. Like, do better at this or do better at that. But in the meantime, you have 4 steps to go before that.
And I would think the key is to not shortcut any one of those steps.
Don't shortcut any of them. Give him adequate time. But I mean, fading from, a or a yes to and then to just this should probably be done over the course of, if you do it every day, it should be done over the course of about 2 weeks.
Okay. All right. Brilliant. Thank you so much.